This week we're talking about frozen shoulder and how it gets wildly and often misdiagnosed, but first, our disclaimer. Dr. Mike Matthews, physical therapist here with the PT 411. Thanks so much for joining me. If you already haven't done so, make sure you follow, like, subscribe, Facebook, YouTube, Instagram, TikTok, and Twitter. Also make sure you check out thept411.com. So, adhesive capsulitis, aka frozen shoulder. Now, it may be somewhat anecdotal, but I do say over the last 10 years of being a physical therapist, it has been the most over and misdiagnosed issue that comes across my caseload. I couldn't even begin to estimate how many people I have seen that claim that they had this issue, either self-diagnosed or told from another healthcare professional. Then a few minutes into the interview, I am already questioning that diagnosis. So we're going to use this video to show some key things to look for so we can either confirm or rule out this diagnosis, because with a correct classification of an injury, we can apply the correct treatment protocols and avoid a waste of time and money with unnecessary treatments. So what is adhesive capsulitis? The actual definition is an insidious or unknown cause of tightness to the joint capsule. The joint capsule is a bulk of connective tissue that surrounds the shoulder's ball and socket joint and its ligaments and tendons. The capsule assists with holding the joint together. It keeps it nice and stable throughout range of motion. The capsule, without cause or explanation, tightens up. Adhesive, tightening, scarring, stiffness, capsulitis, pathology, inflammation, or issues. The thing that makes it a true frozen shoulder is that it happens without cause or explanation. No cause, no trauma to that shoulder. This comes in 4 stages: pain, freezing, frozen, and thawing stages. It can get difficult at times because during the pain and freezing stages, there's nothing we can do to help. No amount of stretches will help it. We just let it run its course. But when it's in the frozen and thawing stages, stretches do help, but it does take time. So just because we don't see improvements quickly, it doesn't mean that it's still in the freezing stage. Now, if we are stretching it out over the course of a month pretty consistently and it's actually getting stiffer and stiffer, we are definitely still in the freezing stage. So how do we see if this is diagnosed correctly? It's actually pretty simple. We raise the arm up, we keep the elbow straight, we lift it up from the front, we lift it up from the side. We can also look at how well we can rotate it. We keep the elbow to the side and we rotate it outwards. Then we can reach behind our back and see how far up we can take it that direction. Now we take mental notes of these. The typical pattern to be seen is most limitation with external rotation here, the second most with abduction, a little less with that internal rotation to the back, and then even less of a limit to flexion going forward. This pattern can vary some from person to person. Now, the biggest tell if the shoulder issue is adhesive capsulitis, we relax the arm and we take it through those same motions, and we use a broomstick for this. We have our flexion, we have our abduction, we have our external rotation, and we have our internal rotation. So if the motion is the exact same with the same amount of pain as when we are actively moving it with the passive motion, it's probably frozen shoulder. If we have greater motion when it's relaxed, it's not frozen shoulder. We need to investigate this more to see if it's an impingement or derangement, or if there's a muscle and or tendon related injury, both of which are definitely treated differently than frozen shoulder. Sometimes we may need someone else to move our arm for us throughout these passive motions to truly get that relaxed passive motion. Now, next video, we're looking at how to treat the frozen shoulder, but since we're talking about diagnosing it in this video, when we are going through that treatment process, if we see a big improvement in motion, usually within the first 3 weeks or so, we still may have misdiagnosed this, and it's really an impingement or a derangement. Frozen shoulder does not respond quickly to stretching. It's not necessarily a bad thing if it turns out to be an impingement or a derangement. If we can understand the behavior of these things, we can treat these very, very quickly, usually within just a few days. Frozen shoulder, on the other hand, does not improve quickly at all. It can take a month or longer to start seeing a difference, if not around 9 months for full recovery. And timing is a factor. If we're stretching it during those pain and freezing stages, it will not help. It'll just be unnecessary added pains during that time. But don't just come to the conclusion too quickly. Give it a little time, 4 weeks or so. If it's not helping within those 4 weeks, rest for a couple weeks, then try again for about another month. Now, the other way that this can be misdiagnosed is more of a technicality. It's after surgery or a traumatic accident. In the past, I've seen people slap these diagnoses on these patients like it's pretty much a trending video on everyone's social media feeds. But it doesn't fit the definition of an idiopathic or unknown cause of tightening of the joint capsule. We know what caused it. We aren't bound by the pain nor freezing stages. That's not to say that after surgery or trauma that this treatment doesn't work. It's definitely a similar treatment under the same principles to gain that mobility back because the capsule does tighten up. So stay tuned next week to see how to treat frozen shoulder. Again, I'm Dr. Mike Matthews, physical therapist here with the PT 411. Thanks for joining me.